Well, it is the fastest growing cancer, and cases have doubled right here in Hawaii over the past decade. We're talking with Dr. Shane Morita to tell us more about thyroid cancer. So thank you for joining us, doctor.
Thank you.
So tell us, what is happening here in the state and what you're seeing as far as thyroid cancer is concerned.
Well, we do know that thyroid cancer tends to be more common in the Filipino population here in Hawaii, which is fairly unusual. The rates are definitely increased. About a decade ago, there were less than 100 cases. Now it's been over 200 recently.
Wow, and we've got some images. Warn you, the first one is a little pink. And so tell us a little bit about, what we're looking at here.
Well, right now, this is a picture of the vocal cords. You'll see that the area right there. And what happens is that sometimes patients come to us and they're hoarse, and so we'll do different imaging. We'll look inside their throat. We'll also do sometimes imaging such as CAT scans to see if it involves the airway.
So that's someone's throat there too?
Correct. The black circle in the middle is their windpipe, and the large mass around that is their thyroid.
Wow. And so how do you determine whether or not it's cancer?
With a needle biopsy. Whenever we do thyroid cancer surgery or any type of thyroid surgery, sometimes we do need to, again, be aware of their nerves. So we'll put in a special tube that has electrodes on it to help monitor the nerve during surgery.
Wow. So how do you go about diagnosing someone with thyroid cancer?
Basically with a biopsy. Someone will put a needle into a thyroid nodule and determine whether or not it's cancerous.
Okay, and then how do you go about treating it after that point?
In general, most patients have papillary thyroid cancer, the most common subtype, and it's treated with surgery, radioactive iodine to destroy any remaining thyroid tissue, and thyroid hormone lifelong to deter any chance of the thyroid cancer coming back.
Are you seeing any trends here in Hawaii?
Well, it is up on the upswing, just like it is nationally.
And so any genetic factors that can have an effect as well? I know you mentioned Filipino heritage, but...
Right. Well, we're looking at a specific gene called the BRAF molecular oncogene, and this is a gene that's not passed on. It's found within the cancer cell, so it can't be passed on within families, but it tends to display a more aggressive course, so we're looking to that.
Oh, interesting. All right, and if people need more information, what should they do?
They're welcome to come to our presentation on Wednesday, and we're going to have a 1-hour talk on thyroid cancer.
All right, at the Queens Medical Center?
Exactly.
Okay, and I guess if you want to inquire about that, contact Queens and let them know Wednesday night there is a talk about thyroid cancer with you and any other doctors?
Just myself.
Okay, well that's good. All right, well thank you so much, Dr. Morita, and I'm sure we'll see you again soon.
All right.
Also coming up, Ellen teams up for an ad campaign with a big...